Epstein. I'm attending the ISHRS's annual meeting being held in Amsterdam. I just returned from the last session. In fact, I was a moderator for the last session on eyebrow transplants. And Spencer suggested that I reply to NW question through a video, and I'm happy to do so. The question essentially, it's a 29-year-old with both traction alopecia that was diagnosed when you were 14, as well as male pattern hair loss. And the question is, should you do FUE, should you take medicines, etc. And while Dr. Cooley provided some nice answers, I just wanted to elaborate and provide you with my thoughts as well. First of all, the degree of hair loss has to be very carefully taken into consideration. We know you have a somewhat limited donor supply, and obviously the first thing is, in addition to the degree of hair loss, we want to make sure that the traction alopecia has any amount of hair that was going to grow back has fully grown back. Assuming that you're at least 6 months to 8 months out, then that would be the case. So then we're dealing with male pattern hair loss. Typically, for a 29-year-old who's not willing to take medication, the approach with hair transplants needs to be a relatively conservative one. We don't want to do, first we don't want to transplant all 29-year-olds. We want to make sure you understand the risk of progression of future hair loss. And then if we are going to do it at the age of 29, especially if you have a nice shaped head, you may want to cut your hair very short, follicular unit extraction would be a reasonable choice. However, once again, limited donor supply means a limited amount of work that can be done. I also do think if you would consider going on Propecia, taking it every other day, 1 milligram finasteride, that would be a reasonable compromise to getting some effects. So I think you need to evaluate your whole situation. I think down the road there may be PRP, platelet-rich plasma injections, which may be of some benefit. I think right now, if you're doing all right, the answer is keep your hair short, live with it, try the Propecia, but if you do decide that a procedure is for you, you need to go to one of the top doctors who will not only make sure not to waste any of your available donor supplies, but also will be able to make the most of your procedure and get the most impressive results that will look natural in the future. This is Dr. Epstein. It's been a pleasure to answer your questions.